Hey everyone, Dr. Liz here. This is a mini episode answering the question of when is hypnosis appropriate versus regular talk therapy? This is a great question. They don't recommend hypnosis for someone who is schizophrenic, having some psychosis go on, delusions, hallucinations, that type of thing. They often don't recommend it for someone who's borderline personality disorder, although I would completely disagree with that. I am trained in dialectical behavior therapy, which originally was developed for suicidal people and BPD, borderline personality disorder. And I think if you know how to work with BPD, you can use hypnosis for wonderful effect to help them regulate, decrease anxiety, decrease depression, all kinds of stuff. So I would say maybe the typical practitioner shouldn't do that, but if you have training specifically for BPD, then it would be a good tool to use. The other type of people that hypnosis is not really good for is people who have a really difficult time going into hypnosis. Now that may be due to several factors. Sometimes that is anxiety, and we have to bring the anxiety down enough for them to be able to go into a more relaxed state. So we start with talk therapy, since I'm an anxiety specialist, and then we can do some hypnosis later if they want that. But that would be the other type of person, is like someone who has a really difficult time relaxing. But if you show up in my office and you really want hypnosis and you are having an extremely difficult time relaxing, believe me, I will work my butt off for you to help you go into hypnosis or learn some skills so that we can actually do that. So there's some like smaller mini skills that people can practice at home that then allows them to do a longer hypnosis later. Now that we've talked about who shouldn't do hypnosis, let's talk about who it can be helpful for. Maybe you've been through several types of therapies and or cognitive behavioral therapy, CBT, and find that perhaps they're helpful, but you're still not where you want to be. Or maybe they weren't helpful. You might want to consider hypnosis. I think it is really helpful for someone who feels like they have some trauma in their history that has not resolved, something that's back there that's still determining their actions, that they feel like they can't help themselves. An example of this is someone who's trying to leave a relationship, knows it's not good for them, but keeps going back to that partner. Another example is often with eating. Overeating or binging is often associated with trauma in someone's history. Not always, but sometimes. Another great use of hypnosis is to accomplish some goals that you feel like you just can never seem to get to. So there was someone I worked with where we used hypnosis to help her change careers. And she had been planning this for 5 years or something and just couldn't make it happen. And we really discovered that there were some beliefs developed early in her childhood that were affecting her in her very adult life that she was leading, that were keeping her stuck in a career that she really didn't want to be in anymore. In the same vein, sometimes there's beliefs holding someone back from having a good relationship and feeling comfortable dating and finding a good partner for themselves. So I've used hypnosis several times for that. Let's get you hooked up here. You want to date a really good person who's honest and compassionate and likes to travel. I don't know. Everyone has their own thing. I have them actually make a list. All right, what are your top 10 qualities that you're looking for? Let's be very specific so that we do change the beliefs going on. We do change the subconscious mind. We align it with these goals now so that you partner well and you feel happy moving forward in that area. So I would say that's a big use of hypnosis versus simply talk therapy. Now, sometimes you just want to talk some things out, get some perspective, do that type of thing. That's totally fine. I do that in my office as well. And even when I go to therapy, sometimes I went hypnosis, but I did around last year. Was it last year? Yeah, I think last year, where I just needed to talk about some things and get some perspective and honestly get some education about an area that was affecting my life that I didn't really know a whole lot about. And it wasn't the type of thing that I could just Google and get the answers to. Okay. I really needed to talk to a specialist and get some answers to some questions. And that was really helpful. We never did hypnosis, even though the person I went to was actually trained in hypnosis. We just did talk therapy, and that was helpful for me. And that was that. In my practice, I use hypnosis as a helpful tool. So we are talking. You can't just like lie down and I wave my little magic wand and boom, you're in a hypnotic state. We do some talking first, and then we do some hypnosis, depending on the session and our goals that day. So I hope that helps you understand when is hypnosis versus talk therapy appropriate. If you have any other questions, please drop me an email, drliz@drlizhypnosis.com. I will be happy to try to answer them. All right, everyone. Have a wonderful day. Peace. I hope you truly enjoyed today's episode. Remember that you can get free hypnosis downloads over at my website, drlizhypnosis.com, drlizhypnosis.com. I work all over the world doing hypnosis. So if you're interested in working with me, please schedule a free consultation over at my website, and we'll see what your goals are and if I can be of service to you in helping you reach them. Finally, if you liked today's episode, please subscribe to the podcast or tell a friend. That way, more and more people learn about the power of hypnosis. All right, everyone, have a wonderful week. Peace. This podcast is not mental health treatment, nor should it replace mental health treatment. If you need therapy or hypnotherapy, please seek treatment from a trained professional.